Hello friends, when you are taking the approval for the prescription for the diabetes mellitus, lot of insurance companies are asking for the one blood test other than the normal blood glucose test. It is HbA1c test. Lot of people are familiar with this term HbA1c test. So what is this HbA1c test and what is the advantage of this test comparing to the normal glucose test? Today we are going to discussing about this topic. Welcome to another chapter of 1 Degree Change, a continuous learning program for the pharmacist. Nowadays, most of the doctors are using HbA1c test to identify how the patient is managing the diabetes mellitus with medicine or exercise or the diet control. Comparing to normal glucose test, this HbA1c test will help doctor to identify the trend of glucose level or how the patient is managing the how the treatment is affecting to the patient. What is this HbA1c? Hb stand for the hemoglobin. Hemoglobin is the major protein found in the RBC. This is the major function of hemoglobin to bound to the oxygen and deliver the oxygen to all over the body. If you go little deeper, the hemoglobin, the 80% of the hemoglobin is composed of a specific component called as HbA, and one very smaller portion of the hemoglobin is composed of some other components. It is divided into three types: HbA1c, HbA1b, HbA1a1 and HbA1a2. In that, the HbA1c is the part binding to the glucose. As per the normal, the major function of hemoglobin to bound to the oxygen and deliver the oxygen to the all over the body. But very small portion of the hemoglobin, what I explained, it is HbA1c. It will bind to small amount of glucose what is present in blood, and this type of hemoglobin that bind to the glucose is called as glycated hemoglobin. Always the amount of glycated hemoglobin present in the blood is directly proportional to the blood glucose level. So the HbA1c test is using to find out the amount of or the percentage of the glycated hemoglobin present. What is the significance of this? As we know, the normal lifespan of an RBC, red blood cells, is 120 days. And that means the lifespan of this HbA1c or the hemoglobin also 120 days. So when we are finding the HbA1c test, this will help the doctor to identify how the patient is managing the diabetes. What is the advantage of this test comparing to the normal blood glucose level test? In the normal blood glucose level depends upon the food what we eat. The reading will be high or low. This test will help the doctor to identify the amount of glucose at particular time. But the HbA1c test will help the patient doctor to get the blood glucose or the management of diabetes for the 3-month period or 120 days period. That's the reason nowadays most of the doctors are preferring HbA1c test for the how patient is managing the diabetes. In the normal human being, a very small percentage of the hemoglobin is always bind to glucose. If the reading is in between 4 and 5.6 is considered as normal, and if the glycated hemoglobin level is in between 5.7 and 6.4 is considered as higher chance of getting diabetics. And if the glycated hemoglobin or the HbA1c test level is more than 6.5% is considered as diabetic. Still, there is also some disadvantage or the limitation for this HbA1c test. The major disadvantage is the people they have anemic or the blood count is less. this type of individual, the HbA1c test will give the some false reading because of the less number of hemoglobin in their body. So the patient have the anemic condition, the HbA1c level will not give an exact reading comparing to their actual blood glucose level. And also in the case of pregnancy, there is a hemoglobin level is different in the pregnant ladies comparing to the normal women. So the HbA1c reading may be inaccurate in the case of pregnant ladies. And just imagine sudden hike happen in the blood glucose in the current time or this nearby days or week, it will give the false reading. So if you comparing the normal glucose test, this HbA1c test mainly help the doctor to check how the patient is managing the diet, medicine or the exercise, and how his changes in the lifestyle and the medication is helping patient to manage the diabetes. I hope all of you get a general idea about what is HbA1c test and what is the significance and what is the limitations. If this information is help you to make a 1-degree change in your professional life, please share with your friends. Thank you.